My name is Gerta Memeti. I'm a student at University of Connecticut School of Pharmacy, and today I'm going to be discussing Epstein Barr virus linked to multiple sclerosis. So first, I want to go over what multiple sclerosis is. Multiple sclerosis is an autoimmune disease that can impact the central nervous system that consists of the brain and spinal cord. The immune system attacks the cells in the myelin, which is a protective sheath that surrounds nerves. When damage occurs to the myelin sheath, the nerve signals that normally go from your brain to other parts of the body will now be interrupted. This damage to the myelin sheath can cause neurological symptoms like loss of balance, muscle weakness, vision problems, or numbness in one or more limbs. There are 4 types of MS. Clinically isolated syndrome is when somebody has a first episode of MS symptoms, but not everybody who has this go on to develop multiple sclerosis. Relapse remitting MS is the most common form of multiple sclerosis. People have flare-ups of new or worsening symptoms, and then periods of remission follow, and that's when symptoms stabilize or go away. Primary progressive MS is when people diagnosed with MS have symptoms that slowly and gradually worsen without any periods of relapse or remission. Secondary progressive MS is when people continue to accumulate nerve damage and symptoms worsen. And while they may experience some flares, they no longer have periods of remission afterwards. So, how common is multiple sclerosis? In the United States, up to 1 million people are living with multiple sclerosis. Developed countries have higher rates of MS than developing countries. Canada has one of the highest rates of MS in the world. MS commonly affects more women than men, and most people with MS receive a diagnosis between the ages of 20 and 40 years old. Here are some possible causes of multiple sclerosis. I'm going to be focusing on the exposure to viruses, especially Epstein Barr virus today. Other causes can include immune system, environment, and genetic mutations. So, what is Epstein Barr virus? Epstein Barr virus is a member of the herpes virus family. It's herpes virus 4. It's one of the most common viruses. Many people are infected with it in childhood, and it's pretty hard to distinguish it from other illnesses. It can cause a common infection known as mononucleosis, and individuals infected with EBV can present themselves with the following symptoms: fatigue, swollen lymph nodes, inflamed throat, swollen liver, or rash. EBV can affect 95% of American adults by the age of 35 to 40 years old. So, how does it spread? Well, it can spread through bodily fluids, saliva, blood, or semen. EBV can spread for weeks when infected, and once the virus is present in the body, it's in a latent stage. Reactivating the virus can cause further spread of EBV, though. Prevention and treatment. So there is a vaccine undergoing phase 1 clinical trials at the moment. I'll touch base on that a little bit later. But other kinds of treatment would be staying hydrated, lots of rest, OTC medications like for pain and fever, which can include acetaminophen or ibuprofen. So, how is multiple sclerosis linked to Epstein-Barr virus? Studies in the past have shown that viral infections can trigger immune-mediated demyelination in the CNS, and Epstein-Barr virus seems to be a top candidate for this. Other studies have shown the presence of Epstein-Barr virus in MS demyelinated lesions as well. But today I'm going to be focusing on a more recent study held by Harvard. So here's an overview of the study itself. It is a longitudinal investigation of MS in those who are negative and those who are infected and those who haven't. And then it was conducted on more than 10 million adults in the US military, and 955 of these people were diagnosed with MS during their service. Researchers analyzed the serum samples taken every 2 years by the military, and the serum concentrations measured neurofilament light chain. That's a biomarker of neuroaxonal degeneration. And it was found that risk of MS was increased by 32-fold after infection with EBV. So this figure kind of shows that EBV infection precedes MS onset and is associated with higher disease risk. EBV infection precedes elevation of neurofilament light chain before the onset of MS. And individuals who developed MS had no signs of neuroaxonal degeneration prior to EBV infection. So EBV infection is a trigger to symptom onset and first detectable mechanism of underlying MS. So these are the results. The findings from the study suggest that EBV infection is a cause and not a consequence of MS. Neurofilament light chain levels are elevated after EBV seroconversion. MS risk is increased after infectious mononucleosis, and anti-EBV nuclear antigen antibodies are strong predictors of MS risk in individuals infected with EBV. Here are some of the treatment options that we have available or developing. An effective treatment for MS at the moment is anti-CD20 monoclonal antibodies. This is administered by intravenous infusion. It depletes circulating memory B cells, which is also a site of latent EBV infection as well. And EBV-specific T cell therapy is basically when T cells are trained to kill EBV-infected cells. There's ongoing studies for this therapy, but it has shown success in transplant patients who are suffering from EBV-related complications. And mRNA vaccine for EBV, it's undergoing phase 1 clinical trials at the moment with Moderna, and in the future we'll learn more about this. If you have any questions, just contact me via email, please. References, and thank you for listening.